Today we're going to talk about Klippel syndrome, which is a syndrome that Oliver from Sailing with Phoenix has. If you're like me, you've been following his journey, and this syndrome is the reason that he decided to, liquidate his 401k and set sail across the Pacific. So let's talk about it. As I always used to do, we start every case study with normal imaging. So this is a normal x-ray of a cervical spine. You can see the intervertebral discs are preserved, meaning there are nice gaps in between all of the vertebral bodies. So the lucency here, the lucency you see between the bones, those are intervertebral discs. They're spongy, they help maintain motion within your neck and your spine. Disclaimer, not my patients, not Oliver. This is all from Radiopedia, which is open to the public. So this is a CT scan, which is also in the same projection as the x-ray we just saw. You can see that we have a bunch of vertebral bodies that are fused. They do not have any intervertebral disc space. There is no lucency between these bones. That is what Klippel syndrome does over time. Here's another x-ray of a different patient with Klippel syndrome. Again, you see lots of vertebral bodies that are fused. There is no intervertebral disc. So when this patient moves, those vertebral bodies will move sort of as basically, if you think about it like Legos, the Legos will all be stacked. There will be no motion. So you have to move them sort of as a full block conglomerate. They don't have any mobility in between those vertebral bodies. And this lack of motion really can lead to what the things that he was saying, like you could be paralyzed from the neck down. They're much more fragile. They can damage his spinal cord more easily than any patient that has those intervertebral discs that allows that motion to persist. So basically that's why he says that he could be paralyzed from the neck down, because he has limited motion, or he might have limited motion in the neck or in the rest of the spine as he gets older. So that was my little radiology synopsis of Klippel syndrome. I hope that was cool. Thanks.